a board member for the Latino Coalition for Healthy California. I come from a part of California that's really the fruit and vegetable bowl of our state and the nation, but there is a paradox. And the paradox is that despite the prosperity that's generated by agriculture in our region, many families struggle to put food on their tables. What I'm talking about is a pervasive poverty that stems from the super exploitation of farm labor, the same thankless people that pick the fruit and vegetables that keep us healthy. The Central Valley is home to the poorest congressional districts. It's often referred to as the New Appalachia. The level of poverty that I want you to comprehend is the level that makes people contemplate really desperate things. But it's also the type of poverty that in itself places you at risk. Community members in our region have to make hard choices about what to put on their tables, and those are entirely driven by what they can afford. The choices that are often put on their table are food products that fill you, but offer very little nutritional value. And the same can be said about the beverage choices that are being made. In many of our communities, sodas have become the default beverage choice because they are cheap and they are readily available. In fact, sodas in most places are less expensive and more readily available than water. And to exacerbate the issue, potable water oftentimes cannot be found in many rural communities. So what choice have we left for our low-income community members? The healthy choice is not the easy choice, and it's not the affordable choice. It's not incomprehensible to understand why we have the highest levels of diabetes and obesity and many other obesity-related illnesses in the state. In fact, our rates are well above state averages. In some counties, 1 in 3 children under the age of 12 are obese, and in others, 60% of adolescents are obese, and in others, 70% of our adult population is obese. So not only have we engineered the choices that people can make, but we've allowed the active promotion, targeting, and reinforcement of unhealthy choices to our most vulnerable community members. Imagine some of the billboards that are in our communities, and I'll describe one for you. In the background, you'll see a piñata that's red, white, and green, and you'll see a family at a picnic table, and they're brown skinned and smiling and happy, and at the bottom it says, "Add more sabor to your life." You know, who do you think that they're targeting with that? It's our community. I'm a Latina who's lived in the Valley all my life, and like many other longtime Valley residents, I have too many family members that are suffering from diabetes. My first experience was my tia Maria. I was in 6th grade when I began giving her insulin injections, and it wasn't too much later that she began to suffer from complications. She lost her sight, and then she lost her feet, and she died shortly after. She could afford the soda that she'd like to drink, but she couldn't afford the diabetes medications that she needed. And this is a true life story about the cost that obesity is having in our communities. It's really about the loss of life. That was my experience in 6th grade, and today many 6th graders and younger are themselves living with type 2 diabetes. It's a shame, and it's indicative of the unhealthy food environment that we have created and allowed. These are choices that are made day after day. And it's choices that are very cognizant to the youth in our region. And I brought for you some photos that were taken from youth. This is a 15-year-old Jasmine in Fresno. And what she's describing in her photo are the fact that there are 7 soda vending machines in her community store, but there's only one that's selling water. The sodas sell for 25 cents and the water's for well over $1. And in this picture, we have a 16-year-old Esmeralda who took this picture of her peers. And what she's expressing is that she feels frustration because young children don't understand the consequences. And it's wrong that adults sell unhealthy foods to children. What kind of message are kids getting? So it's something that's very much understood by our youth. I think what I'd like to close in saying is that we know how to stop the obesity epidemic. We have to create healthy food and beverage choices and promote physical activity environments. But those behaviors happen in environments and happen in context to those environments. So let's make the conscious choice to do that. I think it was Bernard Baruch who said that we can't stop pain, but we can end needless suffering. So in closing and in summary, I guess it's fact that soda is cheaper to purchase than water or milk for many of our communities. It's fact that soda consumption is associated with poverty and race, ethnicity. Lower income people and people of color tend to drink more soda. It's fact that the targeted marketing of empty calories and calorie foods and beverages as well is targeted to low-income and minority populations. And my recommendations would be these, that we need to make access to water greater. It needs to be more affordable, and it needs to be more available. It's ironic that California Labor Code requires that fresh, cool, clean, abundant water is made available to employees, but children in some of our communities have to buy and bring their own water to school because the water in the school is not potable. And poor families suffer from a poverty tax that they have to pay for water that should be made available to them. Sorry. I think it's also another recommendation would be that we really need to limit and eliminate maybe the marketing of unhealthy sweetened beverages to communities most at risk for obesity and diabetes. And just a comment in terms of some of the comments made by industry earlier that really, I think, were directing efforts at education. I'm a health educator by training. We've been educating our community for a very long time about what to eat. And the truth is that they have a lot of knowledge about what the healthy food options are, and they have a desire to really practice healthy behaviors. But they're being burdened by the fact that those healthy choices aren't readily available to them. So if we really want people to practice the knowledge and the behaviors that prevent obesity, we have to make it easy for them. Thank you.
Thank you. I want to thank all three of you. This is not the end of the hearing, but I do want to say a few things before I just personally excuse myself to get to the airport, and I'll trust my colleague, Senator Flores, to conduct our public comment portion of the agenda. But I do want to take a moment before I leave to do some sort of closing comments on my behalf and thank a few people, beginning with the other members of the committee. Senator Flores, certainly for sticking it through to the end here, as well as Senator Price and Alquist for their interest in the committee. I want to thank all the presenters, even those that might have left already, for traveling here today, whether you're coming nearby, from somewhere nearby. Traffic's not always easy in Los Angeles, and we had some folks from different parts of the country. We had a pretty high caliber brain trust here today for this focused discussion. I want to thank all my friends here at the City of Los Angeles, from the members of the council for allowing us to use this space, to all the technical folks behind the scenes that made coordinating this hearing possible, certainly my staff and the Sergeant at Arms Office of the California State Senate for all the logistical support. You know, the context for the hearing was, again, as I mentioned at the beginning, all these reports that seem to be coming out with this link between sugar, sweetened beverage consumption along with obesity and the consequences of obesity. Several of them and several of the witnesses today jump quickly to the recommendation of implementing some sort of tax on these products as a part of the greater fight to take on the obesity epidemic in America and in our state of California. Industry and others said, no, that's not the way to do it. Let's have this conversation. There's other ways to go about it, other strategies. We need to be more comprehensive. So the goal of the hearing from the beginning was to try to pin down, you know, is this real? Is it not? What are we talking about? How can we be smart in our approaches? The one great takeaway I have from today is this movement, at least on the part of Coca-Cola, if not the other companies soon thereafter, in trying to do better labeling, better conveying of the important information from the manufacturer to the